Welcome back, guys. Today we are going to see the step 2 in management of severe acute malnutrition in ITC, that is SAM. Remember, the step 2 is we treat and prevent hypothermia. So what is hypothermia? Hypothermia is a low body temperature of less than 35 degrees Celsius taken auxiliary. If someone is having hypothermia, you will have to assume that that person is also having hypoglycemia and infection. So there's what we call this one is hypoglycemia. This is hypothermia, and this one is infection. So if you get any of this, you have to manage all. If you get hypoglycemia, you need to manage hypothermia. If you get hypothermia, you need to manage hypoglycemia and infection. You manage all these at once. Now, how can we manage someone with the hypothermia in malnutrition? The main goal is to provide warm, and then to stop the patient from getting cold. That is the main thing we should do. Now, how are we going to provide all this to obtain our goal? If someone is having hypothermia, we provide warm by using this blanket here. This is the blanket, the special blanket for malnourished kid. This blanket provides warmth. It's very warm. It is very good. Now, if you're providing warmth, what you do, you will monitor the temperature. The second thing, we have to close all the windows. You need to close all the windows that can make the patients cold, and we need to keep the room warm. Don't expose this baby. Don't expose the child. You should remove all the wet clothes from the baby, making sure that anything where the baby is going to be covered, where the baby is going to sleep, should be dry. The sheet which is wet should also be removed. You use adult bed so that the mother and the child can sleep on the same bed. This one can provide the kangaroo care. The next thing is we have to start this child on a feed. Start the baby on a feed that is F75, 2 hourly or 3 hourly. Monitor the temperature of the baby, and if the temperature normalize, stop warming the baby to prevent the baby from overheat. Do not use hot water bottle. Don't bathe the baby, especially in the morning, and if the baby is very ill. Don't give any hot water or food to the baby. Only give milk to the baby. The therapeutic milk which the doctor has prescribed for the baby. Start the child on antibiotics. That is all how we can manage hypothermia. So in recap, we said hypothermia is the low body temperature of less than 35 degrees Celsius. And if you are managing hypothermia, you should also bear in mind that there is also hypoglycemia and infection. And the management of hypothermia, we said we have to provide warmth, we have to stop coldness, close all the windows, keep the room warm, don't expose the baby, remove all the wet clothes and beddings, use adult bed so that the mother can sleep together with the child to provide the warmth, that is kangaroo care. Start the baby on the feed 2 hourly or 3 hourly, then monitor the temperature. If the temperature normalizes, stop the warmth, and then the caution to be taken: don't use hot water bottle, don't bathe the baby, especially if it is cold or the baby is severely ill. Don't give any hot food or drinks to the baby, only give therapeutic feeds. So that is all. Thank you for watching and see you in the next one.